Hello, we're here today with Nutri Advanced to chat all things maternal wellbeing. I'm Dr. Punam Krishan, I'm an NHS GP, I'm the resident GP on BBC Morning Live, co-host for the Medic Mum podcast and author of a children's book, How to be a Doctor and Other Life-Saving Jobs. But aside from all of that, my main full-time job is I'm a mum to 2 children.
Hi, I'm Sandra Igwe. I am the founder of the Motherhood Group, a social enterprise that supports the Black maternal experience. I'm also an author of My Black Motherhood, and I'm the co-chair of Maternity Care in Racial Injustice.
So Sandra, you've got 2 little ones, is that right?
I've got 2 girls, Zoe and Chloe. One is 6 and one is 4.
And tell me, what was your maternity experiences like with both of them?
If I'm being completely honest, I always say that it was a chaotic surprise. Both of my pregnancies weren't planned. And for me at the time, that was quite a shock because transitioning into, from singlehood, from being just a woman to being a woman that was taking care of 2 under 2s was extremely overwhelming. At the time, my mental health was, I would call, an uphill battle. So I struggled to express my emotions. I struggled with sleepless nights, isolation, but I also struggled to speak up about my experiences at the time as well. What about yourself? Was yours similar to mine, or did you have a blissful, amazing time?
Gosh, do you know what? I've had 2 very, very different experiences, and my kids are 7 years apart. And instantly, we've both got something in common. Both were unplanned. But with my first, actually, despite, I'm a GP, I'd expected and planned for a very kind of normal birth experience. But what I learned was just the spectrum of birth experiences that you'd think that I would have been exposed to as a medic. But I had a very traumatic birth experience with my first child to the point where it all ended up in intensive care with multi-organ failure and a real kind of touch and go situation. So really traumatic. And what came off the back of that was, entry into postnatal depression, which again, I just had thought that I would be immune to. I think you all think that you're always immune to that until you find yourself in the depths of a darkness that you just don't know. So that was my real first experience of what, one, trauma, but also what mental health looks like in the mum sphere.
Yeah.
And that really led to a lot of my work and my practice of kind of helping. I mean, it was a good long time for recovery, but when I did get there, it was just being able to kind of help pull other mums through. We were told we couldn't have any more children, but then 7 years later, in the thick of a pandemic, I have my miracle baby, who's baby number 2.
Wow.
But thanks to the support, and because I was able to speak up to my midwife and then actually get therapy to help with the kind of PTSD that came from that first experience, the second time round was actually blissful and a beautiful joy. You can heal, you can recover. There is hope, but you need the support along the way for it.
No, I completely agree with you. I was a new mum with my first daughter, but obviously I had no idea what that actually meant when it comes to accessing maternity care. With my first daughter, I begged for pain relief and I begged for, the nurses to kind of listen to me, and I just thought that they would, but at the time I felt like my words weren't taken seriously. So the work that I do now is speaking up for mothers within the community who do feel like their voices have been silenced, and how that also impacts their mental health, because I know for me, my mental health definitely was impacted, not just because of perinatal mental health, like my mood, but also feeling like the system that was there, that was supposed to support me, wasn't necessarily my key or my main way of accessing support. I did lean on my family a lot, but I also created a community of other mothers who understood what I was going through. And I found that was my first first experiencing of having a community, having a form of support, having talking therapies. And that really, really helped me a lot when it came to my perinatal experiences as a whole.
I think that's the thing though, isn't it? I think as mums, when you enter into kind of the maternity service in the NHS, it is brilliant in so many ways,
yes.
But actually it's finding that voice, and you kind of feel that there is different camps. Sometimes you could be the empowered person, but if it's your first time, you're actually very vulnerable.
Yeah.
You're very scared.
Yes.
And no matter how much knowledge, I can say that no matter how much knowledge you have, when your body is going through all these changes, you can feel like, am I the only one that this particular thing is happening to? Or if you've got any complications, you need to be able to have someone to speak to that is medical, that can reassure you, and especially when you are going through birth. What did you think were the barriers, or why do you think that it was so difficult for you?
I think, obviously I'm British born, but my family It's Nigerian background, and we're kind of raised to be really strong, independent women. And I think I carried that throughout my entire life. So I think it naturally just seeped into motherhood, where I felt like I can carry everything, I could do everything, I could be everything, be a good wife, be a good mum, take care of my home and run a business and smile simultaneously. And it just became too much. And I think that was a barrier that I didn't even realize at the time that was stopping me from accessing support. And then obviously when I was approached by, midwives and health visitors, I would say, I'm fine, I'm okay. I couldn't admit that I was struggling until it got too much. And I noticed that I wasn't coping. And sometimes, depression, anxiety, other mental health challenges that arise from pregnancy or postpartum looks like, overachieving, overexcelling, working really hard. And that's why I had to look at myself properly and look at my kids and say, actually, it's okay. It's okay to ask for help. It's okay to, ask for support. And that's when I reached out to the services to say, I need extra help. Help me, what can I do next?
The thing is that when a baby is born, all attention naturally migrates to the baby. All your visitors, everybody coming in is focused on the baby. And I think that when there has been an element of, like in my case of trauma, I was separated from my baby for a week. And I think that recovery process was definitely one big barrier. But as my mental health kind of deteriorated, I had this, well, it can't happen to me. And I had knowledge. So I was like, well, no, I'm not ticking this box. I'm fine. I'm going to be fine. Yeah. And it's this terrible thing, isn't it? That we always go, I'm fine. That's why we always say always ask twice. But it was about a good sort of 12, 18 months into it before I actually turned to a health professional. Wow. But I was determined not to look like a failure. And it's the one thing that I look back and deeply regret, that when my health visitor came, when my family were like, we're a bit worried about you, that I wish I'd just gone, well, yeah, actually, things aren't right. But I didn't, because I thought it's not something that could happen to me. And I guess in our sort of, I could maybe say like in ethnic groups as well, like in my background, mental health isn't something that's ever spoken about. Hardly. And especially with women, we just grin and bear and get on with it. It's terrible that we do that. And the conversation needs to change. But I'd very much inherited that my job is to look after my baby. I'm going to put on a smile and get on with it. But actually, I'm really struggling. I'm really sad. I'm not seeing the hope that everyone else sees. And ultimately, when I did reach out for help, it was, in hindsight, I just wish I'd done it earlier, but it was the best thing that I could have ever done for myself and my baby.
Yes, I honestly believe that race had a lot to do with my pregnancy care and my perinatal experiences as well. I honestly believe that services weren't really equipped to understand some of the cultural factors that impacted the way that I wanted to receive care, the way that I wanted to be supported. A lot of the questions that they asked me, I felt like were quite vague, were quite tick-boxed questions, and they didn't really delve deep into, my culture, my faith, my background, my family structure. And I think all of these questions need to be asked, but not just asked in a way where it's just like, let's just ask her, let's just tick the box and get on with it. But really, as you mentioned, unpack, delve deeper. Also, harmful stereotypes, preconceptions, misconceptions that a lot of the services, I believe, have when it comes to ethnic minority mothers and pregnant women. So the notion that we're, really strong and we can handle everything, which is why, unfortunately, Black mothers are the most likely to not have pain relief. Also, to the 5 times more likely, now 4 times more likely to have complications in their pregnancy, 13% more likely to have postnatal depression, and the least likely to access support.
Mums have to be considered and seen at that 6-week check, not just babies. So, I always encourage mums that, especially in the aftermath, when you come to speak about your baby and for that check, that you book a double appointment, that you speak to your doctor about how you are. And as doctors, we should be asking, Mum, how are you? A baby bit's actually quite easy. That part of the examination is quite straightforward, but actually giving mums the space to say, how was your birth? Those things are quite traumatic. And actually what happens is if we subdue that and don't talk about it in the initial stages, it continues to brew. And at some point that bit of trauma will come out. And that might be in a subsequent pregnancy where suddenly you go, God, I've got these awful feelings and I don't know why. So it's important that you unpack it early and you get the support and help that you need early so that you can just heal. Like, healing is more than just the physical.
Exactly.
It's very much a mental, emotional process. You have to deliver holistic care and see each mother as her own. And I think that's it. When you are made to feel like a checklist, it makes you feel even more scared and vulnerable. And fear steps in, doesn't it?
fear, feeling silenced, and you mentioned individualized, personalized care. I think that's the key sentence here is every mother is different. Every mother has her own individual needs, her own requirements, her own fears, her own challenges. And I think that's what we all need to speak more about, is having that personalized care where we feel seen, where we feel empowered to speak and share everything. A lot of mothers also shared with me that they had so many concerns about their baby, about their pregnancy, about their mental health, but they felt like they couldn't speak up. They were scared to come forward because they might be either further stereotyped or may not receive the care that they believe they should have had. So I think if we all had personalized care, more mothers would speak up, more mothers would come forward, and therefore hopefully the stats would lower when it comes to inequalities as well.
Absolutely. And I think, barriers I certainly see, and I say to several of my patients, because I work in an area where we have got, a very diverse population, but, if there's language barriers, simple things like actually having an interpreter there during your appointments makes such a big difference. Not every birth is textbook, and there is no textbook birth really. So, how do you foresee this happening? Like, if it was an ideal scenario, what do you think needs to change?
In an ideal scenario, everyone will be treated as individuals with the utmost quality care, but of course that can't happen overnight. But I think at first instance, all healthcare professionals, from midwives to GPs to practitioners to mental health carers, need to go under training to understand some of the cultural factors, anti-racism training that will help feel empowered to speak to mothers from all backgrounds. I was handed pamphlets and leaflets, but there was no conversations to really unpack what I was getting myself into, and I think that needs to happen a lot more as well. There's a saying that says it takes a village to raise a child, and I didn't really understand that statement until I became a mother myself. But my question is, what does your village look like? Because for some people, they don't necessarily have family around them. I personally moved out of London to the Midlands at the time, so I didn't have my family or my friends close by. So my village were my online mum friends. My village was my partner. My village was, attending, faith-based groups. And for me, I think finding your village that's there to support you in the way that you would like to receive support is really, really important. What does your village look like?
Yeah, so for me, after the birth, which was in London, I was so unwell. Like I had, as I said, I had multi-organ failure, and so I actually ended up moving back to Scotland. So that's 6 weeks postnatally, I moved up to Glasgow just to be close to my mum. I moved in with my mum, my poor husband. He was like, oh God, we're doing this.
Why are we here?
But yeah, no, we came up to Glasgow, and I needed my mum, I needed my sister, and I just needed to be home. I say to all my postnatal mums as well, you do you, whatever works for you. It doesn't necessarily need to be what somebody else has done. And if somebody's had a positive experience, brilliant. But if you find yourself in the group that hasn't, that's also within the spectrum of normal.
Yes.
And therefore we treat that differently. The end point is to get all mums to be healthy, thriving with their little ones, and help them on their journey of motherhood, which, as you say, nobody prepares you for.
No one.
My son is now 9. I still haven't a clue what I'm doing. And there's just going to be milestones along the way. But at each point, you just need to be aware of what your limitations are. And if you think that you are not well, or you're slipping, or something's not working, then reach out, and your GP is always there as a sense of home. So touch base, and I wouldn't be here today if it wasn't for my GP and everybody else along the way that helped me through that.
For me, I feel like there's a lot of pressure to look like we have it all together, as we mentioned. But also social media.
Do you have it all together?
I've not got it all together.
I'm a mess
at all. But I feel like social media is such a powerful tool. It can literally bring people together, but it can also add an extra layer of pressure to look like you're a perfect mum. And I found that in early motherhood, I'd snap pictures of me and my baby and smiling and just only showing the highlights, only showing the positive aspects of motherhood. But I didn't often see the in-between bits. For me, I kind of use that space or that gap to share the truth behind motherhood, because there is an ugly truth to it.
It is.
There's beautiful aspects, but there's also really challenging.
It's the raw bits, isn't it? It's the raw bits, like birth as well. There's lots of raw bits to it. What I see, you know, I walk into the waiting room at the surgery and everyone looks like they've all got it together. You know, they're all kind of made up, looking fine. And I know that behind closed doors, when I say, how are you doing? You know, and I watch people's lives, and, you know, it's incredible in ways that you get a real perspective that everybody has a messy behind the scenes, and that's normal because that's what life is. And parenthood especially, you know, there's lots of good bits, but there's lots of rocky bits as well. And that's the bits I think that when we come together, whether it's social media, whether it's in the books, whether it's in our peer settings, that we're able to say, do you know what, today wasn't a great day. I still love my child, don't judge me. But, you know, I really just want to go and lock myself in the toilet and eat chocolate.
The key word, I think you said, don't judge me. I think that's what I felt, judged. If I really speak up about how I'm feeling, I'll be judged. A child is a blessing. No matter what circumstances, a scenario, a child is a blessing. So what if you don't feel blessed that day? What if you don't feel necessarily, you know, jubilant that day? What is the conversations that we're having? So I feel like right now we need to speak more openly, more louder, more honest about some of the gaps, some of the cracks in motherhood. And hopefully that can kind of take away the stigma around struggling with your mental health as a new mum and all of the in-between bits as well.